I'm Babak Mehrara. I'm the Chief of Plastic Surgery at Memorial Sloan Kettering Cancer Center in New York. One of the things that we do as clinicians is, take care of patients, which is of course very gratifying. But we treat one patient at a time. Nice thing about academic plastic surgery and research is that you can come up with treatments that may affect many patients over time. I think the biggest challenge is always time. Our attention is always being pulled in multiple directions, and if you're operating in the morning and you plan to do research in the afternoon, it really doesn't work well. You've expended a lot of your emotional and otherwise energy. As surgeons, we tend to want to do rather than plan, and you need time to be able to read the literature, understand what was done, and then really formulate a plan, and not just one study at a time, but a 3-year time horizon or a 5-year time horizon. And remember that you're competing against people who do research full time. This is what they do 7 days a week, and they have no other responsibilities. Well, I think primarily the advantage is understanding the clinical course and variability of the disease. When I started doing research, I went to a lymphedema conference. I was shocked that all of the researchers there, many of whom were concentrating on lymphedema, had no idea that lymphedema developed in a delayed manner. They all thought that you had axillary lymph node dissection, and within a period of weeks to months you develop lymphedema, whereas those of us who take care of these patients know that sometimes it takes a year or two, even more than 5 years to develop lymphedema. And I think that lack of insight prevented them from thinking about some of the mechanistic things that may be contributing to the disease. I forced myself. In my early career, I would usually block off 2 days where I would have no clinical responsibilities and I would not do surgery. And so I think you have to be firm, I think you have to be committed, and I think you have to have dedicated time in a repeatable fashion. The most important aspect of being able to translate your work into a clinical arena is to understand the mechanism of what you're looking at. If you don't understand that process, then you can't design therapies that can break that process. When we first started doing lymphedema research, for example, many people were shocked that we had such an immunology focus. But I think it was really that focus that led us to the development of some of the drugs that we're testing now. I think my advice is to do it. I think it does keep life interesting. You have to make a commitment to it. If you're not prepared to do the commitment, it's probably not worth doing, because then you're simply dabbling. And when you dabble, you don't really learn anything meaningful.